Good morning, I'm Dr Christine Selvey from New South Wales Health with the COVID-19 update for Saturday the 8th of January 2022. Across New South Wales, 95.1% of people aged 16 years and over have received one dose of a COVID-19 vaccine and 93.7% have received 2 doses. Of the people aged 12 to 15 years, 81.5% have received the first dose of COVID-19 vaccine and 78.1% have received 2 doses. There are currently 1,795 people with COVID-19 admitted to hospital in New South Wales, with 145 people in intensive care, 40 of whom require ventilation. There were 45,098 cases of COVID-19 reported in New South Wales in the 24 hours to 8 p.m. last night. More than 116,000 COVID-19 tests were reported during that period. Sadly, New South Wales Health is reporting the deaths of 9 people with COVID-19, 4 women and 5 men aged in their 50s, 70s and 90s. New South Wales Health expresses its sincere condolences to the families and loved ones of these people. The New South Wales Government has announced a range of precautionary measures to provide additional support for the health system and community ahead of an anticipated peak of COVID-19 cases later this month. To alleviate pressure on the hospital system and staff, the usual holiday suspension of non-urgent elective surgery has been extended through to February. Private hospital capacity will be utilised where needed, as was the case during the Alpha and Delta outbreaks. Singing and dancing are now prohibited in hospitality venues. This includes pubs, clubs, nightclubs, bars and restaurants, and entertainment facilities and major recreation facilities until January the 27th. This does not apply for weddings or for students and instructors and performers in the settings above. Next week, public health orders will also be updated to include a requirement that people report their positive rapid antigen tests results. This will help ensure positive cases are provided with support and advice about how they can manage their symptoms from home and when they might need to seek extra medical attention. You do not need to get a PCR test to confirm a positive rapid antigen test result, but you should immediately self-isolate for 7 days. If you do have a positive rapid antigen test, please follow all the advice for confirmed cases, including telling your household contacts that they should also do a rapid antigen test and isolate for 7 days. If you are under 65 years of age, have had 2 doses of a COVID-19 vaccine, do not suffer from any chronic conditions and are not pregnant, you can safely manage COVID-19 at home. However, if you are over 65, pregnant, or do have a chronic condition that requires hospital visits or specialist follow-up and are feeling unwell, please call the National Coronavirus Helpline or the New South Wales Health COVID-19 Care at Home support line. If you develop severe symptoms, particularly severe headaches or dizziness, difficulty breathing, chest pressure or pain, please call 000 straight away and tell the ambulance staff that you have been diagnosed with COVID-19. A strong reminder to everyone across New South Wales to get vaccinated now if you have not yet had your first dose, and to get your second dose and your booster as soon as they are due. New South Wales Health is working with vaccination providers across the state in preparation for the rollout of the Pfizer COVID-19 vaccine to children aged 5 to 11 years. This starts on Monday. If you are a parent or caregiver, we encourage you to make a booking for your child at any New South Wales vaccination clinic or at a GP or pharmacy. New South Wales Health's booster program continues to ramp up as more people become eligible for their booster. And New South Wales has already delivered more than 250,000 vaccine booster doses to help keep people safe and increase levels of immunity in the community. Booster doses of COVID-19 are now available for people aged 18 years and over, and everyone should access these 4 months after their second dose. We urge people to get their booster dose as soon as they're eligible to best protect themselves, their loved ones, and the community from the ongoing transmission of COVID-19. We also strongly recommend that people aged 12 years and over who are severely immunocompromised have a third primary dose of vaccine from 2 months after their second dose. Please remember to practice COVID-safe behaviours, including wearing masks, washing and sanitising your hands regularly, and physical distancing. If you are unwell with COVID symptoms, please protect others. Don't go to work, do not go to the shops or socialise. Get tested and isolate until you receive a negative result. Again, thank you for your continuing efforts to get vaccinated, get tested, and helping to limit the spread of COVID-19. Please stay safe.